Sivaraman, Consultant and Medical Director of Shrishti Fertility Center. Ma'am has over 15 years of experience in treating complex fertility conditions. Over to you, ma'am.
Thank you. That's very kind. Thank you so much for inviting us. At the outset, I'm so privileged to be sharing the same stage as such great people and quite insightful talks. It was brilliant. What can I say? We got this acquaintance with Thunai Trust and MSSW. I think we are running close to a couple of years now, and I've got so much to learn from them. The perseverance and being persistent on doing this thing. It's truly inspiring. Truly inspiring. Thank you guys for nurturing me with that particular emotion, to be honest. Okay, so coming to medical education, I've always felt that I think the Indian medical curriculum, there is a big vacuum for mental health, and only when we started taking competitive exams abroad did we actually understand that mental health is such an important thing. When we take exams like PLAB for to work in the UK, we would be given stations like take the blood pressure, do a IV cannulation. These are just peanuts for us because we'd be doing that on a daily basis sort of thing. But then we had more people failing all those stations, and we were shocked to see what was actually going wrong. But the problem there was what they were actually looking for is, you go there, are you explaining the procedure to the patient? Are you getting the consent? Are you are you making sure that the patient is safe and is as much as possible painless to a certain extent? Are you kind of addressing their thoughts of whether they are emotionally kind of terrified about the whole procedure? It could be anything. So that's when I realized that there's been a major vacuum. As doctors, when we're trained here, I have to admit that across the world, Indian doctors, they kind of head every department. And it's amazing how Mother India has produced such wonderful doctors. I'm truly amazed and proud of our Indian doctors, totally. But when it comes to this empathy and the professionalism and the compassion, probably we have a little bit of lacuna there. So that's when we realize that, because every time when we sit for exams, there's a condition for any condition. If you write cognitive behavioral therapy, that's 1 mark for us. That's how important it is. Say for example, in our in our field, where endometriosis is a condition. It's a dooming condition where the woman's going to have pain every cycle. It's going to be so bad that she might have to take off from her work, or say for example, menopausal women. So a happy woman has a happy family. So suddenly, all of a sudden, the woman in her 40s gets all the mood swings and everything, that the whole family suffers. It was never ever addressed. They just think it's part of their change of life, and that's how it is to be. And then suddenly the mum becomes all irritable, and they just say it's just a change of life and just put it off. And we never ever address that. But thanks to people like you guys who made it such an important thing to take this as a core subject, as a livelihood for yourself. And I have a lot of respect for you guys for doing this. Thank you so much. So again, coming to mental health, and I'm sure all of them have already kind of talked about, but then it can happen to somebody who's even giving a psychological counseling. So that's how you cannot expect who's going to get it. Okay, it might be somebody who's a doctor, who's a healthcare provider, who gives a psychological care to a patient on a daily basis. Because it has a lot to do with hormones and how it kind of plays out. Yeah, because we had a patient who wanted to conceive within the next 6 months, and she wanted to have a boy because she already had a girl, and she was expecting her father to be reborn. And then it was quite complicated, her pregnancy, and then she had a nice vaginal birth. So everything she wanted happened, but yet after 2 weeks, she had suicidal tendencies. So that's how, I don't have the right word to put it, because that's how the hormones play up, and we do not know who's going to do that. All of a sudden, sometimes it's too impulsive, sometimes it's too late to kind of catch them. So that's why we made it a point, of course with the help of Thunai Trust, that we do this triaging program and a screening program at every point, so that, at every point, we are able to kind of identify those people because they do not know, and they have come up with such beautiful questionnaires, such clever questionnaires, which will kind of actually identify. At the same time, it asks questions in a way that they are kind of answering that, not even kind of processing for that particular question, but then it can cleverly identify who's going to be a candidate for depression or anxiety or anything. And we did a lot of study, especially in our field. Men have more of anxiety and women have more of depression. It's both, we've done like multiple questionnaires. There's something called vertical questionnaire, and present a paper as well. We have a publication as well, because they are going to be because the fertility or getting pregnant with fertility treatment it's a very, very daunting thing, because for somebody who it just happens, for them it's going to be such a difficult thing. Something which happens so physiological is such a difficult thing for that particular couple. So it's going to be extremely difficult. So that's why we thought like we have to start a program which will address to that problem. And the one other thing is kind of reaching these programs to the couples is becoming such a big task for us. It's very challenging, only because the minute we say like we've come to kind of support you, we're going to come give support to mental health. When we say mental in it, they just think it's mental actual meaning. So they just think like, okay, I have no problems. You just look at the thing when I have. So all the questionnaires, if they ask you, they will say, are you having difficulty in sleeping, or are you anxious about this? Everything is like they say just no. So it happens all the time. And then we actually kind of talk to them and then say like, this is actually for us to help you, because you need, when we're going through fertility treatment, and especially when after they conceive with fertility treatment, they have so much of self-doubts whether this baby is going to be alright. Like Madam said. So at every point we need to kind of handhold them and take them. So that's why we thought we should come up with a program which addresses the whole thing in a much earlier instance, so that the pregnancy would be much smoother, because happy moms make happy babies. So that's how it was birth of the military program. So it's my lethargy and procrastination, in spite of having such a fantastic team, it's getting delayed, but then it's definitely in the pipeline, and it will kind of come to it will be handed over to the deserving couples soon. That's one thing. And then empathy. When I come to empathy, it was such a life lesson when I went to the blind school in Ahmedabad. For half an hour, we'll be in a room of pitch dark. And then a blind person will be asked to lead us and kind of navigate our way out. And that's when we realized, what have we been doing? So I took that course as part of a business module, and then they had said like, this is how a couple would be feeling when they come for fertility treatment or whatever to your hospital. You might be doing this on a day-to-day basis, like a bread and butter, but for them, everything is new. You have to sit down and explain everything. So when the blind person was leading us, they said there would be a bell, you just have to go through that, you will hear this, you will hear. So that's how we realized that actually there's so much we've been kind of missing out on. And we do take a lot of time trying to explain, but then we need a professional like you guys who take up and would be able to kind of identify their inner problem and do that hand-holding. So I have a lot of respect for you guys, and thank you so much for letting us be a part of this. And you're going to go leaps and bounds, and this program is going to be so a super hit. And I'll come back when in 100 days or so, when there are like more registrations, and of course be a part of this. Thank you once again.